So the rest of you tune in. Do not tune out just because you're not standing, all right?
Who's got number one? John's number one.
John's number one. We don't know that.
You ready? Good?
Oh,
So I got 1 through 10. This is pretty common sense stuff, guys. So number 1, what does the acronym DOPE stand for? Displacement, destruction, pneumo, and equipment failure. You're looking at dope when maybe it's hard to bag, your vitals start to trend down, you don't know why. You think something's wrong with your ventilation or oxygenation when you're intubated. That's when you look to start for dope. Number 2, what are 2 major components of offline medical control? There's a bunch of them. And I like to do small words so I can remember this stuff. Standing protocols and QA, QI. I'm sure there's a lot more, but that's what I did. Number 3, name 3 traps that EMS providers fall into when interviewing patients. So, and I've done this numerous amount of times. We got 1, providing false assurance. I think it's really situational, really, but providing false assurance, giving advice, abuse of authority, bad eye contact, arms crossed, interrupting the patient. If you're looking like you don't care, that's what we can fall into sometimes. And number 4, what is evidence-based medicine? This is the best scientific method used to treat patients. Number 5, 3 ways to quickly test an ethical issue. You can get technical. I don't know what Gary wants us to do, but the technical answer is impartiality test, universalizability test, and interpersonal test. This is common sense, guys. Ask yourself what is the best interest of the patient is the most important. Ask yourself if this is what you would want if you were in that same situation, or if your grandmother was in that situation. And then first, do no harm. Also ask yourself whether you can defend or just buy your answers or your treatments. Number 6, name 4 differences between the pediatric and adult airways. The ped patient has a larger tongue. Pediatric patient epiglottis is floppier. Pediatric lungs are smaller. They take 250. We use a different BVM, obviously. And the pediatric patient's trachea is shorter. The whole airway is shorter, obviously. So, number 7, what 5 actions do you need to take when a patient wants to refuse treatment or transport? So the patient needs to be alert and oriented, first of all. State risk of refusing. Try to get help from others, families, and so forth. Call medical control if you really think the patient needs to go when you're in that situation, and make sure to always tell them they can call back at any time after 12 hours. No, just tell them to call back. Number 8, what is the difference between an open and closed stance? Open stance shows you care and are there to listen and help. Examples, good eye contact, hands at sides, palms up, and nodding, just showing that you're listening. Also kneeling to the patient's level. Closed stance shows you don't care. Examples, arms crossed, standing over patient, interrupting, not listening, not showing that you care. Number 9, name the difference between stages 1, 2, and 3 of stress. So, okay, so number 1 is the initial response, flight or fight response, what we do initially and what our bodies, how our bodies react. Number 2 is resistance or coping mechanisms. That's finding healthy ways to deal with stress. And number 3 is the exhaustion. This is the burnout stage. Prolonged exposure to the same stressors leads to exhaustion of individuals' ability to resist and adapt. A period of rest and recovery is necessary for a healthy outcome. And what is informed consent? Number 10. This is consent given based on full disclosure of information. You need to explain to the patient the nature of illness. There's 4 of them. I think we have the textbook in here. Nature of illness, preferred treatments that you'd like to do, risks and benefits of these treatments, and risks of refusal for informed consent.
Thank you, John.
So number 11, social distance of interpersonal space is 1.5 to 3 feet. Main difference between QA and QI, CQI. QA is an individual based, QI is more around an organization as a whole. if you've seen assault and battery, assault is unlawful placing someone in immediate bodily harm. Battery is unlawful touching. 4 rules of evidence. Guidelines, there must be theoretical need for change, must be ample research, clinically important, and it must be affordable, teachable, and practical. Abandonment is leaving a patient before a higher level of care is there to take over. Liable and slander, the difference is liable is damaging a person's name or character through a written statement, slander is through verbal. Scaffolding is that process of kids learning as they grow and learning on what they already know and developing. 3 ways of proper lifting is keeping it close to your core, back straight, asking for help, and telling your partner they're doing a good job. Malfeasance, misfeasance, nonfeasance. Malfeasance is unlawful or wrongful act by a medic. Misfeasance is a legal act that was harmful to the patient. And nonfeasance is failure to do a task. 20 is the classification for the ambulances in the 3 different types.
Jack, number 11, social distance of interpersonal zone, you said it's what?
1.5 to 3.
About 4 to 12.
That was the social one.
So think, and I think that's what the question is.
Interpersonal.
Is that what you got on yours? I'll shut my mouth.
Well, which one do you?
Wait, what do you
I've
think?
got yours on mine.
Which one's gonna be on?
Well, yeah.
All of them. So is it still 1.5 to 3?
Interpersonal.
That's fine. We're cool.
What was the social distance, so Gary?
4 to 12.
You're no man's
Come on,
land
it's
between
just-
3 and 4.
What is your?
Do not stand between 3 and 4 feet. That's how magicians do it. They see 4 feet away. I'm here, I'm not. I'm here, I'm not.
I have 3.5 feet. I'm good.
I am.
21.
We have 21?
Thank you. Go ahead, number 3.
Number 3?
Will that be you?
We already did the KKK standards, right? Okay. Name the 5.
Tiger.
So you're gonna start this out?
KKK 1822 standards. All right. Name the 5 stages of the Kubler-Ross model for grief. This is on volume 1, page 67. It's denial, anger, bargaining, acceptance, and depression. What age group has the highest level of stress? This is volume 2, page 130 and 131. I found early adulthood, but it said financial. I didn't see anything else about any other kind of stress levels.
Volume 2, what?
Page 130 to 131.
So you saying adolescence for that one?
Early adulthood.
Early adulthood.
What is tort law? Volume 1, page 115. It's a branch of civil law, deals with civil wrongs committed by one individual against another. Name the 4 elements of negligence that need to be established. That's volume 1, page 118. Duty to act, breach of that duty, actual damages, and proximate cause. What is the difference between certification and licensure? Volume 1, page 27. Certification. Predetermined certifications that one must go through to be allowed to participate in a given profession. Licensure, certification to perform duties in an occupation. What is reciprocity? Reciprocity. Volume 1, page 27. The process by which an agency grants automatic certification or licensure to an individual who has comparable certification or licensure from another agency. What is the difference between a level 2 and a level 3 trauma center? This is volume 5, page 7. Level 2 area trauma center commits the resources to address the most common trauma emergencies with surgical capabilities available 24 hours a day, 7 days a week. Will stabilize and transport specialty cases to the regional trauma center. Level 3 is a community trauma center, commits to special emergency departments training and has some surgical capabilities. Will usually stabilize and transfer seriously injured trauma patients to a higher level trauma center as needed. So put those together. Level 3 doesn't do surgery all day or have the resources to do major trauma and transfers them to level 2. What makes up the Parkland burn formula, and what is the second simpler formula that you may use for an IV administration in burns? I couldn't find the second one, but the Parkland one is volume 5, page 140 and 141. That's what we had yesterday. 4 cc times the body weight in kilograms times percent of the body area affected.
The second formula is 0.25
Okay,
milliliters.
that's
per
what it is.
scale.
I didn't
So
know
it's
if I
kilograms.
simpler, but that's called the Briand formula.
The Briand formula.
Yeah. What you guys got? What is the Jackson's theory of thermal wounds? That's volume 5, page 125. Zone of coagulation, most damaged area nearest heat source. Cell membrane ruptures and destroyed blood coagulates structured proteins denatured. Zone of stasis, adjunctant to most damaged region, inflammatory present, blood flow decrease. And the zone of hyperemia, area furthest from heat source, limited inflammation and changes in blood flow. And the last question, what is the difference between retrograde and anterograde amnesia? That's volume 5, page 297. Retrograde amnesia, those events lead up to or before the incident, and anterograde amnesia, events following the incident.
Okay, name the 4 events that take place during a vehicle collision. You have the vehicle collision where the vehicle strikes an object, body collision where the occupant strikes the vehicle interior, organ collision where the occupant of the vehicle's interior slows to a stop, tissues behind the contacting surfaces of the occupant's body collide one into another and the body comes to a halt. Then you have secondary collisions where a vehicle occupant is impacted by objects traveling around in the auto. 32. What are the special circumstances on burn patients who are admitted to burn centers? When they admit patients who have partial thickness burns greater than 10%, full thickness burns, significant burns of face, feet, hands, perineum, or major joints, high voltage electrical burns, inhalation burns, chemical burns, and associated significant injuries or medical conditions. The 3 classes of hemorrhage are going to be class 1, which is where the blood loss is up to 15%. Patients may display some nervousness and marginal cool skin and slight pallor. Class 2, blood loss is 15 to 25%. Patients display thirst, anxiety, restlessness, cool, clammy skin, and increased respiratory rate. Class 3, blood loss between 25 and 35%. Patients experience air hunger, tachypnea, severe thirst, anxiety, restlessness, and survival is unlikely without rapid intervention. Class 4 has blood loss greater than 35%, pulse barely palpable, respirations ineffective, patient is lethargic, confused, and moving towards unresponsiveness. Survival is unlikely. What type of injuries frequently result in axial loading? This can happen to a person who lifts too great of a weight for the strength of the lumbar spine. The weight of the upper torso, head, and neck, in addition to the weight of the object being lifted, pushes against the pelvis, legs, and feet, and the lumbar spine is compressed, and the vertebrae is compressed. It can happen when a person falls from great heights and lands on their heels, resulting force is transmitted up the lower extremities to the pelvis and sacrum and the lower spine. Also common in helicopter crashes, where the crash energy is transmitted into the lumbar spine. Just in case, yeah, I typed well. Another frequent mechanism is axial loading when you dive into shallow water and you hit your head on the bottom. It drives the thorax into the head, crushing the cervical spine. And it can also happen in auto crashes, whereas the patient is propelled out the window. It can most likely to compress, fracture, and crush the vertebrae and herniate the discs. Why do alkali burns tend to be worse than chemical burns? It's because they destroy the cell membranes, releasing intercellular interstitial fluid, destroying tissues in a process called liquefaction. Liquefaction, necrosis, progressively dentures proteins and collagen, dissolves fats, dehydrates tissue, and damages blood vessels. What are signs and symptoms of respiratory distress in adults? Labored and rapid breathing, muscle fatigue and general weakness, low blood pressure, discolored skin, cyanosis, headaches, tachycardia, and diminished breath sounds. 37, what is Platinum 10 minutes? The Platinum 10 is the first 10 minutes in which emergency crews arrive on the scene, assess the situation, initiate treatment, and transport critical patients. 38, a down and under vehicle crash creates suspicion of what kind of injuries? The knees contact the firewall under the dash, and we can expect knee, femur, hip dislocations, and fractures are all common. The difference between decorticate and decerebrate posturing is when the patient's back arches backwards and flexes. Decorticate is when the patient's back arches backwards and flexes the arms, whereas decerebrate posturing is where the patient arches their back, but extends the arms out parallel to the body. Both of them are bad and indicate serious head injuries, but decerebrate's worse than decorticate. How much fluids should you administer to a patient with a head injury? Enough to keep their blood pressure above 100.
We're good, okay. 41.
Question.
We going with 100 or 90?
90.
And is that accurate on the down and under? I thought up and over was what caught your legs under the steering wheel causing.
You know, down and under, if you take a look at your book, it's all about lower extremities to include the pelvis.
But isn't there chest, thorax
There
extremity?
can be, but the typical type setup is lower extremities.
Okay. Missed that one on the test.
41.
I'm sorry, Mr. Mitchell.
Gary, for decorticate and decerebrate, can we just do like flexion and extension?
No, it doesn't work that way. And the reason for that, John, is that when you see it in the field, I want you to be aware of the greater relax of the field. So what, just a second, guys. Just a second. So what the question was with the decorticate versus decerebrate, what I'm looking for always is I want descriptions in terms of which one is which. Either towards the core, away from the core, and which one is which.
Might as well, just like the corrugated flexion towards the core,
Yep.
and that's it.
And decerebrate is what?
Extension.
Extension away from. But what John was asking is, can you just get away with saying flexion? No.
Okay.
You just got it.
Okay, thank you. 41. Which space are the kidneys in? Kidneys are located in the posterior portions of the upper left and right quadrants in the retroperitoneal space of the abdomen. 42. Name 5 types of adventitious breath sounds. I'm assuming that's how you say that. I just went ahead and listed them all real quick. Airflow compromised breath sounds are snoring from partial obstruction of the upper airway by the tongue, gurgling from accumulation of blood, vomit, or other secretions in the upper airway. Stridor is a harsh, high-pitched sound heard on inhalation associated with laryngeal edema and constriction. Wheezing is a musical squeaking or whistling sound heard in inspiration and expiration associated with bronchial constriction. Quiet, diminished, or absent breath sounds are ominous findings and indicate serious problem within the airway, breathing, or both. Gas exchange compromises are crackles, a fine bubbling sound heard on inspiration associated with fluid in the smaller bronchioles, and rhonchi, a coarse rattling noise heard on inspiration associated with inflammation, mucus, or fluid in the bronchioles. 43, name 5 systemic complications that occur with burns. Hypothermia is the body's disruption in the body's ability to regulate its core temperature. Hypovolemia is loss of plasma protein, reduces the body's ability to draw fluid from uninjured tissue. Eschar is skin denaturing and full thickness burns that cause dermal cells to become hard and leathery. Infection is the most persistent killer of burn victims, may take days or weeks as pathogens invade the wound. And organ failure, damaged and dying cells release material into the blood that can damage vital organs. What is diffuse axonal injury? I had a hard time finding this in the book, Gary, so you might have to confirm this for me. This was an internet answer. When acceleration or deceleration causes the brain to move within the skull, axons, the part of the nerve cells that allow neurons to send messages between them, are disrupted. As tissue slides over, as tissue slides over tissue, a shearing injury occurs. This causes the lesions that are responsible for unconsciousness as well as the vegetative state that occurs after a severe head injury. The diffuse axonal injury also causes brain cells to die, which cause swelling in the brain. This increased pressure in the brain can cause decreased blood flow to the brain as well as additional injury. Shearing can also release chemicals which can attribute to additional brain injury. Is that all right? It'll work. It's a little extensive, I know.
So what they got, what's in your book is shearing, stretching, or tearing of nerve fibers with subsequent axonal injury.
You got a page for
I
that?
don't. It would be under head injuries, but I don't have it.
45, what are the differences between an epidural and subdural hematoma? Epidural hematoma is bleeding between the dura mater and the skull's interior, usually involves arterial vessels in the temporal region. Due to the high pressure vessel, pressure builds rapidly, increasing intracranial pressure. Subdural hematoma is bleeding within the subarachnoid space, is usually venous blood loss and small, slow bleeding vessels. It can take hours or even days to show symptoms. 46, why does general impression matter? It is It is your initial intuitive evaluation of the patient, known as your view from the door. It is the first clue in determining whether the patient is sick or not sick. It is also the first step in forming an index of suspicion. 3 types of radioactive rays that are given off. Alpha radiation can only travel inches through the air, easily stopped by paper and clothing, cannot penetrate the epidermis. It is most dangerous if inhaled or ingested. Beta radiation can travel 6 to 10 feet through the air, can penetrate some clothing and the first few layers of skin. Gamma radiation, also known as X-rays, is the most powerful ionizing radiation. It can travel through the body or it can ionize any atom within the body and can be stopped by several feet of concrete or many inches of lead. 48. Name the signs and symptoms of someone in neurogenic shock. Neurogenic shock occurs when the spinal cord, brain, or hemorrhage disrupts the brain's ability to control the body. Patients present with slow heart rate, bradycardia, low blood pressure, hypotension, and shock-like symptoms, cool, moist, and pale skin above the injury, warm, dry, and flushed skin below the injury. Male patients may have priapism. By disrupting the sympathetic nervous system, expected symptoms with shock may not occur. Symptoms listed above are opposite that of expected in other states of shock. Why is there a fluid shift? With someone who has burns greater than 15 to 20%. The fluid shift phase begins shortly after the burn and reaches its peak at 6 to 8 hours. Damaged cells release agents that initiate an inflammatory response, which causes increased blood flow to capillaries surrounding the burn and increased capillary permeability. The result is massive edema as fluid is moved away from the intravascular space into the extravascular space. That didn't really answer why, but it's what it is. Is that good enough? Okay, thank you. And 50, what are the 3 factors affecting exposure to radiation? Number 1 is duration. Radiation is a cumulative and a linear relationship. The longer you're exposed, the greater the injury. For example, twice as much time equals twice the injury. Distance. Radiation strength diminishes the farther you are from the source. As you double the distance, the strength is reduced by a factor of 4. And shielding. The more material there is between you and the radiation source, the less exposure there will be. The density of the shielding affects how thick it must be to provide equal protection. Shielding is a linear relationship, saying 3 times the thickness equals 1/3 the exposure.
Hey Justin, it's $2.95 on the Fuse Action. You were asking what volume will take.
Oh, thanks.
What volume was it?
Volume $2.95.
Thanks. Thank you, Secretary.
51, name three phases of the clotting process. Vascular phase, which is the vascular spasm. Platelet phase, where you're starting to get the platelets building up, and then the coagulation phase, where it's clotted and going on from there.
Just a quick question, Gary, sorry. Do we need to explain those, or can we just use vascular platelet coagulation?
It all depends on how I phrase the question.
So yes.
Alright.
And yes.
52, what are the components of the Cushing's reflex and what does it mean? Increased blood pressure, decreased pulse, irregular erratic breathing, and indicates severe brain herniation. 53, name 4 factors hindering the clotting process. Movement of the wound site, aggressive fluid therapy, low body temperature, medications, and low vitamin K, low calcium. Name 3 modified forms of respiration, Kuzmo, bias, and Cheyne-Stokes. It is into thoracic pressure less than, equal to, or greater than atmospheric pressure of the start of ventilation, to equal to. Compare respiration to ventilation. Respiration is the exchange of gases. Ventilation is the mechanical process of moving the air. 67, blood-brain barrier. It's a barrier separating the blood from the brain, parenchyma, everywhere except the hypothalamus. It's permeable to water, oxygen, carbon dioxide, and non-ionic solutes such as glucose, alcohol, general anesthetics. Slightly permeable to some electrolytes and other ionic substances. What does the acronym BURP stand for and when would you use it? It's backwards, upwards, rightwards, and pressure. It's used for innovations when the landmark can be visualized and assist in being the chords. 59, 4 major cations, be sodium, potassium, calcium, and magnesium. 4 factors affecting IV flow rates, vein size, catheter size, tubing, and restriction band left on. And 61 is the purpose of electrolytes.
Oh, we did. Oh,
Keep
sorry.
going then.
Just kidding.
Purpose of electrolyte, sodiums, fluid waters, waterfall salt, and then nerve impulse, and
So, to your question right now on sodium, what else is it famous for? It's the most abundant what?
Electrolyte.
It's the most abundant extracellular cation. Most abundant extracellular cation. Chris, let me go back to what you talked about with burp. Who performs burp?
either the medic performing can, or you have your partner hold.
So more specifically, what we taught you is the person that's doing the intubation is the person that's going to locate that with their own finger,
Yeah, and then
and then have their partner hold them wherever that location might be. Tony, let me take you back. Neurogenic shock you did fine with in terms of signs and symptoms, but based on, think about this a little bit deeper, based on what we've been talking about, now that you've explored that, what are we gonna use in terms of treating neurogenic shock?
What are we gonna use in terms of treating?
Medication that we've been talking about.
Well,
Okay, what were you doing now?
I was under the impression you treat it the way, even though the symptoms are different, you treat it the way you do all.
You're right, but there's a specific medication that we've been talking about.
Lidocaine? Dopamine.
Wow.
I can list them all for you, let's see.
Why?
Hold on, let me look at the signs.
Why would you go with dopamine? Just think about it.
It's gonna help increase the blood pressure.
How?
I don't know, I was a total
So-
guess, I was
so-
so afraid that I got that
so
right.
again, what does dopamine do?
It's a vasoconstrictor.
Right, so the idea that these vessels are like wide open, there's nothing going on there, just kind of sitting there and pooling, the idea that you want to force it on with dopamine in terms of treating a neurogenic shock. Does that make sense?
Yep.
And so as time goes on, going from here, as time goes on, neurogenic shock and dopamine go hand in hand in terms of treatment.
All right.
Nice job, folks, thank you.
What about like a FE-ish?
We'll talk about that after you.
Right.